We'll move to some health developing story that is being reported as a scare, and the health officials in the county of Trans-Nzoia have issued an alert of a suspected Marburg virus case in the region. Now, this comes after a Ugandan citizen suspected to have contracted the highly contagious Marburg fever visited a herbalist, Miss Frida Etiang, at Bwai village, Kaisagat location in Kwanza constituency to seek medication. The herbalist is suspected to have been infected with the virus and is under medical observation, even after her samples tested negative for both Ebola and Marburg, is what the health officials on the ground had to say about the outbreak.
Wasiwasi nyingi sana. Kulikuwa na mwenzetu mmoja ambaye alikuwa upande wa Uganda. Na kule Uganda alikuwa ameonekana na huu ugonjwa. Huu ugonjwa unakuja kwa njia fulani ya homa. Inakuja kwa homa. Ni homa aina fulani. Na ile homa inaitwa viral hemorrhagic fever kwa kimombo. Kwa Kiswahili nafikiri iko na matamshi tofauti. Lakini tujue tu ni homa aina ya Ebola na Marburg ziko katika jamii moja.
Let's now bring in our in-house physician, Dr. Mercy Corey, to just give us a timeline and more about this outbreak. Dr. Mercy, what are we facing here?
Okay, one, Marburg virus disease is in the group of viruses like Ebola. And on the 17th of October in Uganda, the Uganda Virus Research Institute actually confirmed the case of Marburg. And on the 19th of October, they declared the Marburg officially that there was an outbreak in Uganda. This followed a case where a 30-year-old male who actually lives around some of these caves, who was a game hunter, presented these symptoms, was treated for malaria, wasn't responding, and when they confirmed that he actually had Marburg, 5 other cases or 5 other people had actually contracted this virus. And out of the 5, 2 are one who is his sister who was tending to him, and another one is the gentleman you've just mentioned who had made his way to Kenya. And now the other 2 suspected cases were of healthcare workers who are actually taking care of these people just before they were actually confirmed to have Marburg. And as we've said, Marburg is highly contagious. Now, in Kenya, the alert was in the counties of Trans-Nzoia and West Pokot. West Pokot, because that was the entry point of the gentleman from Uganda. And currently, the surveillance in Kenya is on contact tracing and actively searching for any cases or anyone who is presenting with symptoms of Marburg, which would be high fever, sudden onset high fever, and being lethargic, feeling tired, and in the last days is now when somebody will present with bleeding. Now, it's important to note that in the incubation period for Marburg is between 2 to 21 days. That's why during the surveillance period, it will take 21 days for somebody to be observed, in which time, if they present with any of these symptoms, then they are treated as a suspicious case of Marburg. Death usually occurs between 8 to 9 days after the onset of symptoms, and this is now usually after all this and somebody has had bleeding and they have what they call like a ghost-like appearance because of the dehydration. Somebody has been vomiting or bleeding and they look like they are a ghost, they are expressionless, and they have sunken eyes. Now, the most important bit for our viewers to know is on the prevention of Marburg. And one of the most important bit is on being on high alert, and that is the surveillance and the contact tracing that I talked about. And 2, we have rapid response teams by the Ministry of Health on the ground who are actually doing active surveillance. They have quarantined some of these homesteads where this person was noted to have gone to, and they're actually continuing to monitor anyone who's presenting with these symptoms. Now, in the areas where somebody or the people who've died of Marburg, they are treated the same way like we treat Ebola, where they ensure that they have safe and dignified burial so that the people who would actually be taking part in some of these burial rituals are actually prevented or given protective gear in order to bury some of these people so that they don't end up contracting the virus, because any contact with any fluid, any blood, any sweat from somebody who is infected is actually highly contagious. Basic hand hygiene for everyone is actually encouraged, and most importantly now for the healthcare workers, so that they prevent spread of the infection, is to have a personal protective gear or personal protective equipment. Like they will double glove, they will have gloves, they'll have masks, so that they don't contract the virus and spread it to other people that they're actually taking care of. Now, this is an important, something to note about Marburg. It was first reported in 1967 in Marburg and Frankfurt. That was the first case of an outbreak of Marburg. And this was following, that was in Germany. This was following some of the monkeys that had been transported from Uganda that was being done for research in Germany. And that's now the first place where Marburg was.
In lay terms, how grave is the situation, and is the Ministry of Health equipped to keep an eye on this?
Well, the Ministry of Health says it is well equipped to keep an eye on it, but we know that our nurses have been on strike for 150 days now. So the capacity may be challenged, but they have assured us that they have rapid response teams on the ground. They are doing cross-border meetings with the Ministry of Health in Uganda, so that there's a heightened surveillance on our border, so that we prevent a lot of this cross-border transmission of the virus, especially because it's on the eastern Uganda side, the Queen district, and the western part of Kenya, West Pokot, Trans-Nzoia, and the counties along that border.
Thank you so much, Dr. Marcy Korir, of course, keeping an eye on that developing, very important story. You're watching KT.